Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic with Technique Tuesday. Just a side note, I was wearing this shirt one time and a former employer said I looked like Charlie Harper. I don't agree, but anyhow, that's what he said. So anyhow, today we're going to do a quick series on shoulder pain. So a couple of exercises that might work if you're having shoulder pain. And I'm going to there's several you can do, but I'm going to go over the most common patterns. So oftentimes what we'll see with a patient is they either have limited or painful flexion. So what you might see, so say my left side is the affected shoulder, and what you might see when they raise their head is either it will hurt, you can tell they're in pain, or sometimes you even see this, okay? Or abduction, which is going this way, so you'd see either kind of a stutter because it hurts, or it's just limited, okay? So this is an exercise that often works for that. It's called repeated extension. So level one would be make sure your palm is facing backward, and you're just going to reach back as far as you can. Hold it about 2 seconds and return. Hold it about 2 seconds and return. That typically isn't going to be end range for most people. It's not going to get you far enough, so you might need a little implement like a dowel or a cane or something, and you can hold on to it this way, and then you're just going to extend the arm back behind you. The trick with this one, though, is what you'll see a lot of people do is they'll start to stray away from their body. You want to keep the dowel rod right against your body, and you go back as far as you can. Okay, just like that. The goal is to try to get, if you can, to about 90 degrees or so. Okay, and then what you would do is you would recheck the motion afterward. When you do that, it's normal to feel a pretty strong stretch in this front part of the arm or shoulder. If the pain intensifies as you do it, I would stop and then check with your physical therapist to make sure that it is appropriate. But most times what you'll find is it's uncomfortable and it gets better and better the more you go, and then you know it might be the right motion for you. And then when you get done, you just recheck your motion. Okay? And if it feels better or you're getting higher, it's likely a good exercise for you. Okay? But it's not for everyone. If you had a reverse total shoulder, I wouldn't do it. If you have a known instability in the shoulder, I wouldn't do it, okay? But just check with your doctor or physical therapist before doing to make sure that it is appropriate for you. So again, this is repeated shoulder extension, either just using your muscles to get it back there, or if that's not getting you far enough for the therapeutic effect, you would use a dowel rod. I would probably do 10 to 15 reps every 3 to 4 hours, okay? All right, there you have it, repeated shoulder extension. Thank you.